talk to me about seizure management. How do you manage seizures?
So for cdoc patients, we're closely monitoring the physical risks. And if any patient got infections, eye, chest, urine, and they highly trigger the seizure. So usually on the prescription charts, on the regular charts, they always have a long-term regular anti-epilepsy drugs. That is usually prior to admission or later on reviewed. On the PRN chart, they have this rectal diazepam or midazolam, bacolam, and have when the event of seizure occurs. And also any long-term these epilepsy drugs, when interacting with a high level of protein, you have to communicate with the dietitian to make sure the gaps between the feed and the administration of that anti-epilepsy has to be 2 hours before and after, has to stop, because that otherwise, if you give it together, will be really affecting the absorptions of anti-epilepsy drugs. So as I said, this is a high protein bound of the special phenytoin and the other drugs. And also in terms of these drugs, every 2 months we need to check the blood concentration levels. Should be in their therapeutic window. If it's below, means high risk of chance of get seizure. If it's high, toxic, long term for the livers and all these side effects. So every 2 months we have to that review of this one. So this is long-term management monitoring. And so first of all, seizures, we have to find immediately give emergency. If patient in bed, give rectal diazepam. If it's in chest with bacolam, treat them first, then find out triggers. 9 out of 10 triggered by infections. Patients got these indwelling catheters and chest infection, got trachees. The ventilator is that pneumonia, that ventilator associated pneumonia. Then seizures, back to seizures. So of course, first of all, you need to give some oxygens, because the majority of patients have seizures of lack of oxygen in the brain, so give supplement. And also make sure there is not too tight trachea, and also in the corticoid protections, there is no any hard materials, any flashing light, any stimulants, external stimulants, just need to remove it. Not bright light or flashing light, or any pain or any sore, or any abscess on the body, need to check it over. And also sometimes so much saliva dribbling, and just be careful when you young sucker, not biting, especially, you just need to be careful really. And it depends, just to control the seizures, to control the symptoms. And according to, the patient well, you just to eliminate any triggers for the seizure and manage emergency and find the trigger infection, treat infections. Then after that, just to continue monitoring for the next few days. Then after that, back to normal. This has to be communicated with the families, because sometimes the families need to know, what happened, keep them informed. And they will let you know, no, I think my son is going to have a seizure soon because this has happened to her last time. So it's kind of communication, staff know well and patient know well. And so it's just kind of everybody working together to know the person well, this patient well.